Victoria will launch pill testing at music festivals from this December.
I just want to encourage patrons to use the service if they are thinking of doing that.
We will help make your criminal activity a little bit safer.
How did we end up here? Pill testing is starting to be incorporated into more and more music festivals across the world. What's the point of all this? I thought the whole take on drugs was that they're bad, let's do everything, stay away from them, and we crack them out of society. This pill testing seems a far cry away from that, a far cry away from the war on drugs. How did we end up here? Is pill testing actually a good idea? Let's check it out. Let's see. I'm Hayden. This is my cartography. The war on drugs started in 1971, where President Richard Nixon declared drug abuse to be America's public enemy #1. This declaration came after a rapid increase in the number of people that were coming back from the Vietnam War with a drug addiction. To mobilize the war on drugs, Nixon increased the federal budget on anti-drug efforts from $81 million up to a minimum of $350 million. He established the DEA and began large-scale drug operations to seize drugs all around the country. Between 1972 and 1973, he had already incarcerated over 6,000 Americans for drug-related offences. From this point, drug policy in America remained relatively unchanged up until the arrival of President Ronald Reagan in 1981. Reagan, from here, took a much more heavy-handed approach to drug policy. Against the background of the crack cocaine epidemic, Reagan ramped up federal budget spending and also brought in significantly harsher penalties for drug-related offences. One in particular was the mandatory minimums for crack cocaine and pure cocaine. Reagan also targeted cannabis, pushing harsher penalties for possession, cultivation, and distribution. Law enforcement were given greater resources to crack down on drug supply, often coordinating efforts with customs services, the FBI, and other federal-based services. Reagan also used widespread public service announcements to try and deter kids, young people, from even trying to use drugs. Of note was the Just Say No campaign set up by his wife, Nancy Reagan.
There's something out there. It's after kids everywhere. It entices them, confuses them, and can even kill them. That's right. Illegal drugs are everywhere.
We can see here that some of them were pretty ludicrous, obvious, and clear that they were trying to demonize people using drugs. So how did these tactics fare? Well, the mass media coverage succeeded in causing widespread fear and concern in the public about the rampant drug use that was going on. Statistics show an increase of 8-fold in the years between 1980 and 1997 in the rate of incarcerations for drug-related offences. In the early 2000s, Australia saw great success in causing what they called the heroin drought. They were effective in decreasing the supply of heroin, increased its associated price in the black market, reducing the overall use of heroin, and, best of all, reducing the number of heroin overdoses in that time frame. Likewise, Canada was able to solve their problem with opioids. After replacing OxyContin with OxyNeo on pharmacy shelves, they were able to significantly curb the amount of people that were misusing the drug for an opioid high. But see, here's where the success of the anti-drug efforts really start to fall apart. It really seems more like a smoke and mirrors kind of situation when you look deeper into it. What do I mean by that? Well, if you look at what happened in Australia, that decrease in heroin was actually offset by an increase in cocaine and methamphetamines. In Canada, that decrease in OxyContin use was offset by an increase in fentanyl use, a drug that's far more potent and deadly. These flow-on effects aren't anything new. Heard of the Prohibition? In 1920, America decided to ban all alcohol use. It only lasted 12 years and it was a major failure. It didn't actually stop people from drinking, it merely shifted the ways in which people got it. People started making alcohol at home. Illegal bars called speakeasies popped up everywhere. Bootleggers were able to smuggle in alcohol from other countries like Mexico and Canada. And rich people were sitting pretty on their collection that they'd stocked up prior to when that prohibition was set in place in 1920. So there was a lot of people still using alcohol despite the ban. Essentially, the alcohol industry changed from commercial, regulated industries where the government had a hand in controlling it to nefarious organized crime gangs. Prohibition is a clear example of how making a drug illegal doesn't necessarily translate to less drug use. 50 years on, the war on drugs has shown similar kinds of outcomes. Despite trillions and trillions of dollars, harsh penalties, increasing drug busts, and the demonization of people who use drugs, the rate of drug use hasn't actually really changed across the years. In fact, the rate of overdosing itself has increased recently. In 2022, the USA saw over 100,000 overdoses. That's massive. The war on drugs has also incarcerated a ludicrous proportion of the overall global population. Approximately 10% of prison inmates worldwide are there on drug-related charges. In the US, of the drug-related offences, 40% of inmates are there on simple possession charges. What good does this do for society? Yes, we may have locked up some die-hard criminals, but 5 years for simple possession of 5 grams of crack cocaine, when 5 years is equal to 500 grams of pure cocaine, it doesn't seem fair. Many critics suggest that this mandatory minimums policy was racially targeted towards black people. The disproportionate charges of crack versus pure cocaine have meant that a larger amount of low-income people have found themselves in jail. Crack cocaine is cheap, and in lower communities, they tend to be more black people in these communities, whilst richer neighbourhoods tend to be more white, and this is where people are more able to skirt under that 500 gram limit for pure cocaine. This racial disparity is well documented and not uncommon in American politics. Richard Nixon himself declared at the start of the war on drugs that in fact it was actually racially motivated. John Ehrlichman, who was assistant to the President of Domestic Affairs, had this to say at the time. The Nixon campaign in 1968 and the Nixon White House after that had two enemies: the anti-war left and black people. We knew we couldn't make it illegal to be either against the war or black, but by getting the public to associate the hippies with marijuana and blacks with heroin, and then criminalizing both heavily, we could disrupt those communities, we could arrest their leaders, raid their homes, break up their meetings, and vilify them night after night on the evening news. The integrity of the whole war on drugs was built on a lie, and because of it, American prisons are overcrowded with a disproportionate number of black Americans in there, and over 100,000 people a year are dying from drug overdoses, with a further 350,000 dying indirectly. And the mass stigmatization of people who use drugs has led to a significant falsity of those people seeking out treatment because they don't trust the system. You have to ask yourself, who are we trying to help? If it was the public, then crime will be down and the streets will be safer. They aren't. If it was drug users, then overdose numbers, substance use disorders, and bloodborne diseases numbers will be down. They aren't. So why didn't the war on drugs work? Well, there's a few different explanations that we can look into. Firstly, they took a zero tolerance approach. No use, no sale, no manufacturing, no trafficking of any illicit substances. Whilst it is well-intentioned and noble, it begets the old saying, where there's a will, there's a way. People have been using drugs since ancient times. Ancient Greeks drank opium-laden poppy juice. The ancient Chinese used cannabis. Incan civilizations chewed on coca leaves, and countless civilizations found their own ways of developing and drinking alcohol. Using drugs appears to be quite universal and part of the human condition. And so it's unsurprising that the research shows that whether or not drugs are criminalized or not, stigmatized or not, there isn't much change in whether or not it's consumed. Coming back to the age-old saying, where there's a will, there's a way, drugs are inherently profitable. Many drugs are craved for their psychoactive effects, and they're also quite highly addictive. Drug dealers can more easily sell their inventory if they help their clients get that drug addiction. They're incentivized to perpetuate that cycle of drug use. And it's virtually impossible to completely prevent people from manufacturing illicit substances. since they derive from a lot of natural and synthetic ingredients that can be easy to come by. That's what the prohibition on alcohol showed us. It's a futile effort because if there's a market out there, there's always going to be organizations popping up to sell to that market. The second reason for the failure of the war on drugs relates to how heavy-handed it was evoking those harsh penalties. Draconian policies rarely seem to be effective in this space. The World Health Organization conducted a mass study across 17 different countries and found that countries with more stringent drug policies didn't actually have any lower levels of drug use compared to those with more liberal policies. A third and final reason centers on the deterrence theory approach. Proponents of the theory argue that implementing legislation and harsh penalties would discourage people from using drugs. Now we can pick apart this theory using competing theories from the area of behavioral psychology. On the surface, punishing people for making, selling, and using drugs makes sense. Drugs are inherently harmful. They can cause fatal accidents, overdosing can cause death, poor management can lead to addiction, and long-term use can lead to a myriad of physical and mental health related issues. These outcomes aren't good on an individual or societal level. So it's good to employ some measures to try and deter people from using drugs, absolutely. Where punishment goes wrong is the fact that it doesn't necessarily tell the person what is right, only what's wrong. By that point, it doesn't do much to change the behavior, i.e. the person never learns how they can try and make money outside of selling drugs, or how they can manage their anxiety outside of trying to get high. Punishment systems are also susceptible to workarounds. You tell your son that he can't watch TV, so he just waits till you have a bath and then puts the TV on low volume. People still want their fix, and threatening them with punishment isn't necessarily going to change that. They just learn that they need to find a new way of skirting the system so as to not get caught. This story is ever present in punishment-based systems. Why do you think that criminals are so good at adapting to any new changes law enforcement throws at them? Lastly, punishments do nothing to address the underlying factors behind the behavior. All they do is label that behavior as bad without correcting any of the issues that are causing it. It's like your mum coming in after you've hit your brother and punishing you for that, completely ignoring the fact that he was intimidating and insulting you all day. Only by understanding the underlying factors can we truly challenge that problem behavior. Okay, so if the war on drugs is flawed, what can we do about it? Pill testing. Hear me out. People are already using drugs and they're going to continue to do it whether or not it's illegal or not. Yet, there's a lot of people that are dying from overdoses that can be prevented. With effective pill testing, we can try and reduce that number. There are over 30 different sites around the world that employ pill testing facilities. What they do is they test out the drugs that people are already about to take. Usually it's a small sample like a scraping from a pill. And from this they conduct analysis and determine how potent it is, the purity of that substance, and if it's been laced with something else like fentanyl. They can also give advice on how the drug may affect the person based on whether or not it will interact with other medications or medical conditions that they have. The user then has the discretion to work out whether or not they think it's safe and whether or not they want to proceed with taking that drug. It's all completely anonymous and by the law. So, does it work? Short answer? Yeah, it does. From what we can see in the data, especially at music festival sites, pill testing has significantly reduced the rate of on-site medical visits as well as hospitalization from accidental drug harm. But Hayden, I know what you're going to say. Doesn't it encourage drug use? Doesn't it encourage drug use? Surely. Actually, no. It doesn't, at least not from any of the data that we've collected so far. In fact, it's actually had an opposite effect. We've seen a large amount of people rejecting that drug once they find out that it's no longer safe. And that's fair enough. A study in Australia found that of the drugs that they tested, only 53% actually matched the drug that it was meant to be. Pill testing is just one of the strategies nested within this overall umbrella of harm minimization strategies. Harm minimization focuses less on preventing drug use and more on mitigating the harms that are associated with it. Other successful strategies have been taking naltrexone, safe injecting sites, and opioid substitutes. Together, they've had major success in reducing the number of overdoses, the rate of public injecting and discarded needles that are out there, the rate of drug-related infections, and also bloodborne diseases. Again, this is without any evidence to suggest that these strategies increase the use of illicit substances or even increase the level of crime. Best of all, harm minimization strategies increase the contact between people who use drugs and health professionals. This contact is vital in helping people who use drugs to build a trusting relationship with the whole system. And we need their trust in order to better provide treatment to them, but also really to conduct good, effective research. Because only through understanding why people use drugs and the habits that they get into can we best develop policies that are good for prevention and intervention. So bringing it all together and looking back at everything we've talked about today, it's pretty clear that the war on drugs didn't work. It's seen as a failure, not just by myself, but a vast array of critics out there. In hindsight, looking at it, seems pretty foolish to think that something as complex as drug use behavior could be solved by simple measures in deterrence and supply intervention. The reasons for why people use drugs are far and wide, and to be honest, obviously beyond the scope of this video, but hopefully from what I've shown today, you can see that we're beginning to understand a little bit more as to what those factors contributing to drug use are. Western countries have started to move progressively more towards a harm minimization approach. We're also moving towards greater efforts in decriminalization as well. So it'll be interesting to see where we're at in another 50 years from now. Will the war on drugs be a massive thing in the past, or will it be efforts that we continue to run with in some way or another in the future? Let me know in the comments what you guys think will happen in 50 years and what your opinions are regarding the war on drugs and harm minimization strategies. But anyway, that's a wrap for this video. Hope you enjoyed it. If you did, give us a like and subscribe along, and I will see you guys in the next video. Bye for now.